International Conference on AIDS and STIs in Africa is now underway in eThekwini. The meeting, which is being held on a mostly virtual basis, is aimed at strengthening healthcare programs in countries on our continent and to further investigate how the COVID-19 pandemic is impacting efforts to curb the spread of sexually transmitted infections. South Africa remains among countries with a high prevalence of HIV and AIDS. Newzroom Africa's Corinda Jacmahan joins us now to have a look at what's happening at the conference. Corinda, good afternoon to you. Unfortunately, as I understand, the conference affected by COVID-19 itself. It's had to really go virtual.
That's correct, Stephen. As of early this week, we understood from a press briefing by the KZN Premier just announcing that the conference will now be changed. It will no longer be seeing delegates arrive at the Durban ICC to watch some of the speakers in person. The conference will be held virtually. This after, during the registration week, some members actually tested positive. Even while collecting accreditation to attend the conference, one has to go a mandatory COVID-19 test as well as present your vaccine certificate. And so we understand that while this was happening, some members tested positive, and as a result, this conference, about a year now in the making, is going to be held virtually with just some of the main speakers attending the Durban ICC in person to be amongst the cameras that will actually stream this live for delegates to participate in.
What are going to be the main issues? I mean, obviously one of the big fears is how COVID-19 has impacted the fight against HIV/AIDS.
Well, this conference comes in, as you mentioned, that countries within the African continent are among those that have some of the highest prevalence of HIV and AIDS as well as sexually transmitted diseases. And according to the NICD, the National Institute for Communicable Diseases in South Africa, they say that STIs, it's estimated that globally more than 1 million people are diagnosed with one or more sexually transmitted infections like gonorrhea, chlamydia, or syphilis every day. This is a major cause for concern because what we understand is that if going untreated, STIs can further affect one's sexual, reproductive, and general health, leading to major health issues that would require a further health treatment, including invasive operations. And it's a cause for concern in South Africa, especially as of 2017, according to this confirmed statistics we have, there were 7.9 million people living in South Africa with HIV and AIDS, which also then recorded a high volume of STIs. And it's said that when one has an STI, they become more, they may more likely be infected with HIV and AIDS, which will further impact their immune system. Some of the statistics that I've just seen now is that in 2017, there were an estimated 2.3 million new cases of gonorrhea, and mostly among women aged between 15 and 49. So at this conference, from what the stats are saying to us, there will be major discussions around improving Africa's healthcare and its approach to trying to assist, especially young people, with protection to avoid them contracting STIs and ultimately perhaps leading to an HIV diagnosis. We're also going to be looking then at how role players can help, specifically traditional leaders in rural communities, how they can inform young people there. And also among the discussions will be how COVID-19 has further impacted on the healthcare system's ability to try and infiltrate the spread of HIV and AIDS and STI. So this afternoon at around 5 o'clock will be the official opening of the conference, and then the conference will continue virtually from today up until the end of the week, where various discussions, conferences, and seminars will be held discussing how Africa can improve its healthcare systems with regards to STIs.
It also shows you the value, I would imagine, Corinda, of a coordinated approach. What happens in one country with regard to a disease will often affect the country next to it. And that's why it's important to make sure that we all work together on this.
That's correct. I mean, the COVID-19 pandemic has showed us that the world cannot operate on its own. Countries cannot operate in isolation when it comes to looking at healthcare systems. We've got to work together and to provide, especially when we look at countries that are more developed, assisting underdeveloped countries with healthcare systems and trying to achieve healthcare objectives. We know that with regards to HIV and AIDS, the powers that be with regards to organizations that are trying to decrease the transmission of HIV and AIDS. They're trying to achieve various objectives by 2030 in order to decrease the spread of HIV and AIDS, especially in underdeveloped countries. But they have said throughout various conferences, speeches, and the likes that they can only do this with the assistance and funding of further developed countries, your USA, your European Unions. We need the assistance of these countries, and more especially their funding and technology that will assist underdeveloped countries where even access to water is an issue. So this is also some of the conversations that will be taking place at the conference, and hopefully we'll see that in one of the conference rooms there's quite a few exhibitions where you have various countries just trying to showcase what they are trying to do in their local communities to curb the spread of the sexually transmitted diseases, but as well as HIV and AIDS. And through these exhibitions, hoping that some representatives of developed countries will come through and see how they can assist with trying to improve the lives of the people on the ground.
Corinda Shakmahan, our reporter in eThekwini this afternoon, do appreciate the time covering that conference for us. Thanks very much indeed. Well.